Hey guys, we're live. It's 1 o'clock. I don't have any idea if anybody's watching this thing, so I'm just going to start talking. And I'm hoping to see some comments that are questions. I can answer anything you like. So just getting fired up here on Facebook. Welcome if you just jumped on. If you have questions about anything, fire away. So I don't really have anything planned in particular to talk about, but I see some, looks like eyeballs coming on the thing, so welcome everybody. If you can hear me out there, send me a note that you can hear me loud and clear. Let me know where you're watching from and that you can hear me okay. This is the first time I've tried this, so it's all new. Gonna give myself a thumbs up, see if that worked. Oh, Shelby, you can hear me. Thanks for commenting. So most of you guys probably know, but I'm one of the docs at Circle of Life, and I'm probably the biggest techno junkie in the office. I have a YouTube channel over on YouTube. That's Wes D Ski. If you search for that, you can find about 70 different videos. A lot of them are birth stories, people having babies, and about half of them are also educational. So lots of different topics to talk about. If anybody has any questions right off the bat, since this is a Q&A, I want to make sure you guys have the time to ask questions. So if anybody has a question, you can put it in the comments. I can see those popping up on the screen now, so don't be shy. And fire away. Well, nobody's jumping in with any questions. Hey, Kristen, how's it going? Thanks for giving me a comment, so I know you're on there and you can hear me. I have a talk that I was going to give as a YouTube video that I can start just giving you some information that's just kind of postpartum care. Do you guys want to hear something about that? Do you want to hear, is there any other topic you'd like me to talk about while I'm just finding something to tell you? Oh, thanks, Kristen. I appreciate that. Okay, well, if anybody has any questions they want, just throw them in there. Otherwise, I'm just going to give you a little chat here on what's going to be postpartum care talk that I'm going to do. Oh, here we go. When do your hormones get back to normal after you have a baby? Is there anything to do with the crazy hormones? That's funny. That's actually in the list of things to talk about. You know, most things that we blame pregnancy on, we blame for about 6 weeks. So that's when most people are hormonally more or less back to normal. But obviously, you know, things like postpartum depression and anxiety and all that are a whole different story. And you can see stuff like that hanging around for, you know, weeks and months and even a year after delivery. So there's kind of, when people say they're talking about their hormones, if you just mean kind of the normal bluesy stuff, sort of emotional ups and downs, crying for no good reason, that stuff tends to go away within a few weeks. But if it's more serious stuff, then that could last. And the way that I tell people to kind of think about the difference is not only how long did it last, but also, you know, how bad does it impair your ability to function? So, you know, are you getting out of bed? Are you enjoying the baby? Is your life otherwise feeling good and normal to you? And if it is, and it's just like out of the blue, randomly you start to cry or something, or get angry all of a sudden, that's pretty normal. And that typically lasts a few weeks. So hopefully that answers the question for you, Jenna. Let's see. Anybody else have any questions right off the bat? Don't be shy. No question is a dumb question in this situation. I will tell you also about the hormone thing that hot flashes are pretty common. People ask about that. Yeah, mostly anxiety. It's pretty common. Again, I would look at like, how does it affect your ability to function? So if you're getting through the day, you're not having major panic attacks, and otherwise feels okay, then it's probably normal stuff. But you can look at other things too, like, when you can, how's your sleep? Thanks somebody for that heart going by. That means somebody's seeing this. That's good. But anyways, I say, like, if you're having panic attacks, you can't go out of the house, you're feeling so anxious, stuff like that. That's definitely more than just typical baby blues kind of anxiety. And in that respect, I think it's probably worth, talking to your doctor at the office. And there's definitely some things we can do that are safe, if you're nursing even, that are very helpful. So good question. I'm sure you're not the only person out there feeling that way. If anybody else has felt that way out there, chime in with your comments. Let them know. Let them know not alone. Okay, how long after pregnancy can you return to your normal workout routine? So if you had, hey Destiny, by the way, let me see. It's okay, Cooper. Oh, all right.
Hello.
So usually about 2-3 weeks, if you're feeling okay, if you didn't have a C-section scar. Sorry, someone's at the door. It's our very nice neighbor giving us something. So anyway, if you didn't have a C-section, if you had a vaginal delivery, and you feel well, then really within a week or two, you're pretty much fine. So when the bleeding's under control and you feel okay, you can pretty much get back at it. But it's a little different if you had a C-section. Then you probably ought to wait like 4 to 6 weeks for more substantial workouts. Let me know if that doesn't answer your question. Okay, hey Kara, birth control regulates, but worried about getting the breast cancer. Yeah, it's a thing, and maybe you're referring to that. I made a video on my YouTube channel about that, and maybe that's where you're referencing. It really is a personal decision, and one of the things, you're welcome, Jenna. One of the things to just think about when I talk to patients in the office is to say, short-term versus long-term, because the risk is really in the long-term. A year or two of use, there was some slight increased risk, but you really saw the biggest risk in folks who've been using it 5 years, 10 years, stuff like that. So, if you're thinking short-term, that's probably not such a big deal. But, let's just say for sake of argument, you're in your 30s and or even your 40s, and maybe you're done having kids, you're thinking longer term. Those are the people that I think really need to have a serious thought about this, and think more big picture, like, do you get sterilization? Do you go with a copper IUD? Stuff like that, because in that regard, you're avoiding the breast cancer risk. I see some other people jumping on, so I'm just going to say, hey, welcome. It's Dr. Wes Davis from Circle of Life. We're just doing a live Facebook Q&A. This is the first time, so if you can hear me out there loud and clear, give me a shout out, thumbs up or something, so I know you're out there. Just trying this for the first time. Thanks for somebody's thumbs up. And if you have questions, don't be shy. You can jump on. We were just talking about some postpartum stuff, but really any question, it's ask me anything. Okay, is birth weight genetic? Is there a certain weight where C-section is? Okay, Bailey. So it's a good question. The short answer is there's no single answer. It would be great if I could just tell you yes, no, here's the number. If you don't have diabetes, which is a whole different discussion, so let's just assume you don't have gestational diabetes. If you've got an estimated fetal weight of under 10 pounds, it's certainly reasonable to give it a try. If you're talking about over 10 pounds and you haven't previously had a 10-pound baby and you're not 6, sorry guys, I don't know if I cut out there for a second. If you're not like 6 feet tall and wear a size 10 shoe, then maybe a 10-pound baby is a little too much. But to some extent, birth weight is genetic. And if you're diabetic, then definitely 4,500 grams, which is around 10 pounds. We're just going to say, hey, it's probably safer to do the C-section. But under that, it's all relative. And the things I tell everybody are, you never know how big of a baby you can have until you have it, and you never know how big the baby is until you put them on the scale. So there's too much variability. Ultrasound is just too inaccurate to really take it home and know for sure that you've definitely got a certain weight of a baby. So, within reason, everybody, it's okay to give it a try if you're under 10 pounds. Okay, so Jenna asks, what are the side effects of copper IUD? Really, the main thing is just heavier periods. They tend to be regular, but they tend to be a little longer, maybe a little crampier and a little heavier. Now, at least one study would show that, or indicated that it would, that kind of settles down over time. So it's not as bad as you go forward. Some people say, oh yeah, the whole time I had the IUD, my periods were heavier. But the nice thing is you're avoiding the hormonal risk, which is probably a good thing, especially if you're talking, long term. So good question. All right, I'm just going to scroll through these and see if I missed anybody's question. I don't think I did. I think I'm staying on top of this pretty good so far. Let's see. Okay, I'm all caught up on questions. So if anybody else has a question, here we go. Hypothyroidism. Thanks, Ashley. How often do you levels check? Okay, well, so two questions there are pregnant versus not pregnant. So if you're pregnant, it's really important to get the levels dialed in. If you were pregnant and on medication, then we often increase the dose right away because we know the requirements are going to go up. But if you're not pregnant, it's not such an emergency. You can take a little more time. I usually check, like let's say we're starting somebody new, then I'm going to check their levels about every 4 to 6 weeks until it looks like we've got good results and that they stabilize. And if they stay stable over a couple, then you're probably good to check it every 6 months to a year. It also kind of depends on the underlying cause. So some things that lead to hypothyroidism are big time moving targets and require much closer follow up and probably referral to an endocrinologist. You know, things like Hashimoto's thyroiditis and stuff like that. So hopefully that answers your question there. Let's see what we else have. Is there something you do to prevent hypothyroidism from getting worse? Unfortunately, no. You know, a lot of them are autoimmune, and there's no real prevention. It's just mostly important to just make sure your levels are being followed closely and that you're being replaced adequately. So hopefully that answers the question. All right, we got some questions rolling here now, so this is good. All right, so let's see. Heather asked what kind of doctor we're talking about low sex drive. Oh, congrats, Heather. I was glad that, thank you very much for the kind words there. And low sex drive is something, you know, that we can talk about in the office. I always tell women are complicated. Men are really simple. Pretty much there's, with a few exceptions, not many things that cause men to have low sex drive. I always make the joke that, like, you know, they could just find out their grandma just died, and thumbs up for that. But, you know, if you got 5 minutes, they're good to go. So women are much more complicated. I always say, you know, to the extent that you can make things like your relationship situation, are there any issues there? Are you feeling fulfilled and whole as a person? You know, those kind of emotional things are really, really important for women. And a lot of times when you start asking people those questions, they go, yeah, well, things haven't been the greatest at home. Or, yep, I'm really stressed out because I've got 4 kids and don't have any time for myself, you know, things like that. So to the extent that you can address those kind of things, that's definitely going to help. Always do an exam, make sure nothing is painful, because of course if it's painful, who wants to have sex? So, you know, make sure nothing's wrong physically that could be causing that. So, you know, once you get beyond those things, it starts to get a little trickier, but that's a good place to start. So thanks for that question. Let's see what else we have here. So, okay, Ashley, it says, oh, you were diagnosed at your first prenatal 6 months postpartum now, so just following up on that. Yeah, probably, you know, if you're stable at 6 months on the hypothyroidism, then you're probably good. Okay, so Tiffany asked, do you continue treating ADD during pregnancy or taper off? So we typically don't use the ADD meds in pregnancy. There's just not enough information to know if it's safe or not, or what the long-term effects might be for the baby. And there definitely are concerns, stimulants and what they may do to a developing brain. So I tell my patients, you know, I just stop them while you're pregnant, play it safe. Irregular periods, that's the second question of what can cause irregular periods, is a long list. And first you kind of start with, are you talking about less frequent periods, so they're not coming on a regular basis, or are you talking about more frequent periods? So you kind of got to break them into those two categories. With less frequent periods, you're mostly talking about things like PCOS, hypothyroidism, elevated prolactin levels, stuff like that. So a lot of hormonal stuff leads to less frequent periods. More frequent periods is more commonly going to be something anatomical, so fibroids, polyps, stuff like that. So a lot of times a question like that, you need to visit the office so we can get a full grasp of what's really going on, do a physical exam, ultrasound, some blood work, stuff like that, and we can probably get a pretty good answer for you there, Tiffany. Okay. Oh, well, thank you, Kristen. Hey, it's good to see you. Happy holidays to you, too. Okay. Napua says, been on the Mirena for 3.5 years, some pretty wild mood swings. Yeah, the IUD, could that be a part of it? It could be. You know, honestly, and check out my YouTube channel. It's Wes D Ski on YouTube. Just put all one word. There's a whole new video in there on hormonal effects. It's primarily to do with breast cancer, with hormonal birth control. But for the longest time, we really thought that IUDs, the dose was so low, there's no way that you were possibly going to have any bad effects from it, whether it was breast cancer, mood, weight gain, whatever. But this recent study I talk about in the YouTube video, there are definitely effects, and it's pretty clear even with just the low dose of hormones in a Mirena that it's putting you at a little bit of higher risk for breast cancer. And so it's made me rethink everything about the hormonal effects of the IUD. So, we know that birth control pills can cause mood problems. And of course they're hormonal. So no reason to think that the IUD couldn't also do that. And that for me is a definite change in how I thought about things thanks to this recent study that I talk about in that YouTube video. So hopefully that answers your question. Let's see. Amy says, if you have a cyst and it bursts, if your cyst ruptures and you're in, flip it around. Basically, if you're in severe pain, that could be a ruptured cyst, and it's worth getting checked out in the office. If you were just having some pain and you were found to have a cyst on an ultrasound, and then the pain kind of goes away, well, the cyst probably went away as well. We generally follow up an ovarian cyst somewhere in the 2 to 3 month neighborhood, just to make sure it went away. But if your pain's not too bad, then not an emergency. And basically, if your pain goes away, then probably nothing to worry about. So good. Keep these questions rolling. Thanks for the thumbs up, guys. I know you're out there listening. So let's see. Christina said, took a long time to have a baby. Could you try again and have another? One question, Christina, is, if you're nursing or not. Because if you're nursing, then that may delay ovulation. And that's kind of nature's birth control. So with nursing, you might not have a period. And if you're not having a period, it's going to be pretty hard to get pregnant because you're probably not ovulating. If you have stopped nursing, there's really no hard and fast time frame that you need to wait or you must wait. So I think if you're ready, just go for it. The only thing that there's some studies out there showing is that it can be a little hard to lose the pregnancy weight from the first baby if you get pregnant really soon after with the second baby. And that kind of makes sense. If you haven't had enough time to go by to kind of get back into a healthy lifestyle and lose some weight. But if that's not a big concern, then there's really no reason to wait, especially if you're not nursing. I'd say, hey, just go for it. Okay, Jamie says, I've heard of women getting pregnant with the Mirena. How'd you know if pregnancy? It's a good question. A lot of people will have other signs of pregnancy, and just to say up front, it's rare. Something like 1 in 1,000 women per year. So you let 1,000 women go on the Mirena. One of them got pregnant per year, so pretty small numbers. But you're right. If you're not having a period, how are you supposed to know if you're pregnant? Probably other symptoms. So if you start having some breast tenderness or some nausea or something like that, then might check a pregnancy test. But again, just realize it's pretty rare. So I wouldn't worry too much about that. Okay, so Jadrian says, what advice do you have for women who struggle with anxiety or depression during or after pregnancy? I think the most important thing and I made a YouTube video about this. I'm going to say that a lot. I made a YouTube video about this. The use of antidepressants and SSRIs in general, so Paxil, Prozac, Zoloft, all those, they are safe in pregnancy. And I discuss it in a lot of detail in the YouTube video, so I'm sorry if I'm repeating myself. If you go to YouTube and just type in Wes D Ski, all one word, you'll find my YouTube channel. And it's listed in there under patient info videos, SSRI risks in pregnancy. But the bottom line is that being treated is definitely the most important thing. And that doesn't necessarily mean medication, but medication is a big part of it. Counseling, therapy also are very helpful. But the big advice is don't shy away from treatment because you're worried about the risk. Because there's plenty of data that shows that the risk is basically minimal to non-existent. And it's way more important in terms of the benefits that you get the treatment that you need. Okay, so Kelsey, what do you have? What advice have I encourage sensible feedback? The big thing, Kelsey, I made a YouTube video about this. It's called VBAC. You can do it. The most important thing to know is that the chances are very good. And in the video, there's a link in the description at the top of the video that takes you to a website where you can put in your own information, age, height, weight, ethnicity, reason for C-section, a lot of details. And basically, it will calculate the number for you and tell you, here's the chance of success, 75% chance. Here's the range you can expect, 80 to 75, whatever. I'm sorry, getting a notification. Got a patient in labor, so small chance I may have to run out of here to go deliver a baby. But that's my son Cooper. Hey, everybody. But anyway, the big advice is to know that you can do it, and the chances are very good. And we used to worry so much about the risk of the VBAC, and the risk is actually very, very low. It's less than 1% that you're going to have a complication like a uterine rupture. Now, it doesn't mean they don't happen; they do, and when they happen, they're bad. So, my advice is, try for a VBAC in the hospital. Don't try at home, because if something bad happens at home, you're out of luck. But that's the big one. Is just knowing that you can probably do it, and the odds are pretty good. But check out the video for more details and see what you think. Try the go in the description and find the link. Put in your information. Do the calculation. You'll see the numbers for yourself. Put it in the comments of that video. Let me know what you got. I'm curious to hear what your number was, and you might be surprised how good it is. And if you have questions about it, just put them in the comments of that YouTube video. I check it sort of like, I don't know, every 10 minutes. All right, Tiffany says the antidepressants that won't decrease sex drive. Thank you very much for the kind words. You're welcome to have another baby, or just come by to visit. But as far as antidepressants and libido, basically the newer the SSRI, the better. So the worst ones are the old ones. So Paxil, Prozac, Zoloft. Those have the worst reduced libido. And typically the newer generation ones, one of the things they try to do to make themselves stand out from the generics is reduce side effect profile. So libido is a big one. You tend to see less of an issue with, say, Lexapro or Celexa. Now, Celexa is generic, but it's newer than the Zolofts and all those others. So I tend to hear less complaints about that one from patients. And so you maybe look at like Lexapro if the Celexa wasn't good. There's Vibrid, Wellbutrin. Wellbutrin is notorious for not reducing sex drive. So sometimes we'll either combine that. So say somebody's on Zoloft and is doing great, but they're having problems with decreased libido, then we'll throw in some Wellbutrin. Or if you have somebody who's done poorly in the past on, say, Zoloft or one of those, and they don't want to try Celexa or Lexapro, then maybe consider Wellbutrin. You can't take it if you have a history of a seizure disorder, but that's really the only contraindication. So otherwise, pretty well tolerated drug. It's generic now too, so it's pretty cheap, and that's a good go-to option for you. All right, so good question, Tiffany. Thank you. All right, Shan says, can you get pregnant with Liletta? Yeah, you can. It's rare, but it happens. So about the same as the Mirena, about 1 person per 1,000 per year gets pregnant with an IUD in place. So it's not impossible. If you think you're pregnant, check a pregnancy test. That's my advice. All right. Kylie says, when do you usually recommend going on maternity leave? The short answer is a lot of people work up until the time they have the baby, and that's totally fine. But it just sort of depends on your job. So, if you have a really physical job, you're doing a lot of lifting, it's causing a lot of pain, stuff like that, then, you may need to go out a little sooner, and that's perfectly fine. But there's no hard and fast, like you must stop by this day. Have plenty of patients that are nurses that are working. I had a patient who's a life flight nurse who worked her shift, landed the helicopter at McKay, her water broke, she came inside and had a baby. She is a tough woman. I give her credit. But point is, if your job's not too physical, you can keep working until you have the baby as long as you feel okay. Oh, thanks, Napua. I was going with the odds there. All right, Cheyenne says, let's see, if not, how long does it take to get pregnant after getting it out of her? Something? Oh, no. So, Cheyenne, the question is like delayed return to fertility with IUDs. It's just not true. There is immediate return to fertility, so there's no worries about that at all, assuming no complications. So assuming you didn't have some bad infection or have to have surgery because of an IUD, and those are rare, but assuming you just took it out and you're going to start having a baby, I tell people you can get pregnant the day you take it out for all you know, so don't worry about that. You mentioned someone having trouble getting pregnant. It's probably something else was going on with them besides the IUD, so I wouldn't worry about that. All right. Oops, sorry. Let me go back. I lost my comments. I'm back. Sorry. Okay, we're back. Sorry, I hit the wrong button there. When can you? Okay, Katie. Let's see. When can you resume running after C-section? 2-3 weeks if it's not hurting. I mean, basically, you know, a big part of this is, you know, what was your level of fitness before you had the baby? And so, you know, if you're somebody who's running on a regular basis and 2 or 3 weeks in, you feel okay, it'd be okay to go for a short, easy, slow run. It's going to feel slow. It's probably going to hurt. So, you know, if it doesn't hurt too bad and you otherwise feel okay, it's probably fine. You know, you may still have some pain in your low back just from pregnancy or the symphysis pubis pain. And so some of those things may be really annoying. They're not dangerous. So basically, I kind of give people that, you know, listen to your body. If it's not hurting too bad, it's probably fine. I really appreciate patients where I'm having to be like, hey, slow down a little bit there. You know, don't go run a marathon 3 weeks after you had the baby. So that's always good to be active, and I definitely encourage that. So I don't want to discourage you. Just kind of listen to your body. Okay, Kimberly says, sister-in-law's disabled. It's been on birth control for years because she had bad reaction to menstrual blood. Depo, but now let me see if I can get it to come up the rest of the way. I think it, so Kimberly, I'm sorry, your question, it cuts off. So if you want to pick up after, at first the Depo shot, but now she's on oral birth control pills, I'm assuming it says. It kind of cuts off there. So there must be a limit to the number of characters you can enter, but if you want to get your question rephrased into about, looks like 4 lines, then we'll be good, and I'll try to come back. All right, let's see. Amber said, oh, thanks, Amber. That's very nice for you to say. So yeah, Napua, the YouTube channel, it's Wes D Ski. So WESDSKI. I like to ski. And if you just search on that, yeah, there it is, Wes D Ski. Thanks, Jenna. If you just search that, you'll find it. And hey, that's a plug too for the YouTube channel. I'm a smoothie fanatic. If you're one of my patients or you've seen my videos, you know this already. I'm giving away a Vitamix smoothie blender. All you gotta do to enter is subscribe to my YouTube channel, and then also put a comment on the video that is the Vitamix smoothie blender giveaway, and you'll find it just about 4 or 5 down from the top on the list of videos. So just a plug for that, because I want somebody from the practice to win this blender. All right, let me see. Yeah, oh, so the question about osteoporosis with Depo. Yeah, it's a theoretical concern. Probably now the bigger question is the breast cancer risk, honestly. So, you know, Depo-Provera is another one of these hormonal birth controls. Kimberly, you might want to check out my YouTube channel. There's another video on there about that's regarding the hormonal risk of all the different birth control methods with regard to breast cancer. So, yeah, osteoporosis is a little bit of a risk, but nothing like probably the breast cancer risk for long term. So, you might want to check out that video. Yeah, sorry, I think I got that. Second one does not increase chance of breast cancer. Yeah, so, sorry, I see the rest of your question now. So anything non-hormonal, so, you know, copper IUD is the main long-term non-hormonal versus sterilization. So, you know, those are options. I have had some patients who have been, you know, that are disabled, that have, you know, problems with their periods. And, you know, we do things like that in those situations. A lot of times it requires, you know, proof of guardianship for someone if they are mentally incapacitated. Now, if it's just physically disabled and they can speak for themselves, then it's not as big of a deal. But there's definitely some things that can be done that are non-hormonal. So I'd encourage you to just have make an appointment in the office, and you can kind of go through some of those in more detail. But I would try to get off hormones long term because of the breast cancer risk. All right, let's see. Oh, thanks, Bethany. How's it going? You're rad too. All right, Kylie. Yep, follow that smoothie. You can get that smoothie maker, Kylie. All right. How many natural births have you seen, and how many natural births? I'm assuming you mean like unmedicated births, and the answer is too many to count. I've learned, one time I tried to do the math of how many deliveries I've done in my life, and it's like over 10,000. So, you know, I don't know the exact number of people who were unmedicated in those 10,000 deliveries, but, you know, probably over 1,000 if I had to guess. I just did one, in fact, before I had started this channel, this YouTube live today. I was just finishing up an unmedicated birth, and her mom did great. So yeah, I mean, totally supportive. It's my only thing is have a baby in the hospital, or, you know, because I think it's a safer option than a home birth. And I know for some people that might be a controversial statement, but having been through a few thousand deliveries and seen some things happen, I'm always glad I work in a hospital where I can help if something bad happens quickly. So yeah, I'd say I'm supportive. Let's see, Shelby. Questions about chronic cough. Let's see, horrible cough, 3 months of pregnancy. Can't get much. A lot of times it's reflux, Shelby. It's good hearing from you, by the way. But reflux is a common cause of cough. So, if you haven't tried that, then that's one to consider. And a lot of people, the cough goes away when they have the baby. So I think it's reflux a lot of times. So I'd start with that, and then, getting a physical exam, take a listen to your lungs, make sure it's not asthma. Chronic sinus infections can sometimes do it, allergies. There's a few things that I would take a stab at, but reflux is number one in pregnancy for sure. All right, I'm seeing a few people jumping on here too, so just a quick welcome, everybody. Hey, if you don't know me, Dr. Wes Davis at Circle of Life. We're just doing a live Facebook Q&A. Hopefully you can hear me okay. If you can, hit that thumbs up or a heart button or something so I can see you're out there. If you have questions, you can see there's a list of questions just rolling by, so I'm just knocking these out. So let's see if there's anything else on here. So Amanda asked, what have I seen on ablations, good or bad? Overall good. What I tell people is about 80 to 85% of folks, thanks for the thumbs up, guys, about 85% of people are going to see either less period or no period. And it's about half and half. So about half of that 85% sees no period, and about half sees less of a period. So, if your periods are bad and those odds sound good to you, then I'd say that's a pretty good experience. If you look long term, 5-10 years down the road, you do see some people's periods coming back. And that's probably because, one little part of the endometrium didn't die, and now it's regenerating, and so they're getting a period. So there can be some issues there. But overall, I'd say pretty favorable. It sure beats the heck out of a hysterectomy. I think we're going to see a lot more ablations as we move away from long-term use of hormonal birth controls, like, say, an IUD. I've told a million people in the past an IUD is a great thing for your period. It is. Unfortunately, also what we now know is about a 1 in 7,000 per year risk of breast cancer. So, I think we may see some people coming back and saying, hey, I want to take that IUD out and get an ablation. So that's probably going to be something that's hot for 2018. Alrighty, Amber says best birth control because of the issue with pumping. Copper IUD, I'm going to start sounding like a broken record. I made a YouTube video about this. And basically, copper IUD is the only thing that's not hormonal. I know you say you're too scared to do an IUD. IUDs are great, and if you want to put in here in the comments what you're scared of. Hey Samantha, thanks for the comment on the YouTube. I just got the pop up on that. That's cool. But anyway, as far as the IUD goes, my general experience, and I've been doing this for 20 years, is very favorable with IUDs, and it's becoming much more leaning towards the copper IUD. Sorry, hopefully you guys can still hear me. I was getting a call there. Anyways, talking about copper IUDs is probably going to be a hot topic this year to stay away from the birth control or from the hormonal birth control. Okay, so I may have to go do a delivery soon. I'm going to see if I can run through some of these real quick. And if you guys like this, put some comments afterwards. We can always do another one down the road. Let's see, Haley. Hey, Haley. Mood swings after the last baby. Had to go on antidepressant for a little while. Anticipate same thing. Yeah, it's it varies, but I typically tell people, if it happened before, I just start up your meds when you have the baby, and that'll probably be better. Just reduce your risk. You can wait and see, and treat if you start having symptoms, but more times than not, we just start folks up and say, hey, just prevent it. Okay, let's see. Oh, okay, so Saeed here asks, well, you can check us out on the web. It's www.colwc.com, and it's linked in the Facebook account up there as well. Let's see, do home pregnancy tests go to positive? Yeah, if you have a positive pregnancy test, whether you have an IUD in or not, you're going to see a positive on the test, so it wouldn't affect the results. Okay, Stacy, time to wait after regular. Okay, so if you want to try to have a vaginal birth after C-section, and again, broken record, sorry, I made a YouTube video about this. Go to Wes D Ski on YouTube, and it's called Vaginal Birth After C-section. You can do it. If you look at the timing that is less than 2 years between deliveries and more than 2 years, you have less risk of complications if it's 2 years or more than if it's less, and that's primarily related to the uterine rupture risk. Although I've VBAC'd people who had less than 2 years before and they did fine. So I don't think it's a deal breaker, but if you wanted to be sort of an ideal world, then you'd say, try to make it so there's 2 years between your deliveries. Amber says, oh, thank you, you're welcome. All right, cool. So so I'm checking my watch here to make sure I haven't gotten a text to come for delivery. So far, nothing. So if anybody else has any last minute questions, I'm happy to try to answer them before I have to jump off here. Oh, hey, okay. Sorry, I'm like echoing myself here on the screen. Let me mute that. There we go. Pro VBAC. Yeah, I'm pro VBAC. I'm so pro VBAC about it. I made a YouTube video about it. I'm totally pro VBAC. I'm doing a VBAC right now. In fact, I've got a patient who's like 5 centimeters doing a VBAC right now. Whoa, okay, we're rolling here. Let me see what else we got. Signs of preeclampsia, primarily blood pressure elevation, swelling, and protein in the urine are the most common. Other symptoms are headaches, seeing spots, upper abdominal pain, stuff like that. Most common, in the 3rd trimester, and less common in the 2nd trimester, and almost unheard of in the 1st trimester. So if you have any symptoms like that, my advice always, come see us, get a blood pressure check, see what's going on. Reasons for not being able to dilate. One of the biggest things, Taylor, is that enough time has not been allowed to pass. So there's this article, and I'm gonna make a YouTube video about it. It's called "Preventing the First C-Section," and it is all about understanding what really is the normal, natural course of labor, and it's changed. So we used to think it was a certain way, and it moved at a certain pace, and what we've learned over time is it's just not true. It takes longer than you think it does. So more than anything, making sure that you've had enough time pass. And my experience, changing also what we think of as active labor, so less than 6 centimeters versus 6 centimeters or more. If you're beyond 6, if you're 6 centimeters or above, then that's now what we consider active labor. If you've not changed your cervix for 4 to 6 hours, depending on the situation, then it's probably time to think about the C-section. And in that situation, the reasons are probably something like the baby's too big, your pelvis is too small, or the position's not right for the baby, something like that. But honestly, the main reason that C-sections happen is that enough time did not pass. So stay tuned for that YouTube video. I've been thinking about making that one for a while. So Taylor, you may have just inspired me to do that later on today. Okay, so Camille asked, her first baby is usually overdue or come early. I don't know that there's any definite on that. I will tell you that 95% of people deliver prior to 41 weeks, and a ton of them deliver between 40 and 41. But every week, especially say from 36, 37 weeks on, somebody's having a baby. So I don't know if there's any definite rhyme or reason on that question, sorry. Okay, Sarah says, how do you feel about birth? How about birth center, birth rather than home birth? Well, birth center is better than a home birth, but so I practiced in North Carolina in the past, and there was a hospital system that had a birth center that was physically connected to the hospital. And I think that, if you were going to do a birth center birth, that's probably your best bet, because if they had a problem, all they had to do was wheel. They had like a skywalk type thing that crossed the street, and they just pushed them across the skywalk, and they were on labor and delivery. And so, in those rare situations, when something bad happens, it can happen fast. And if your proximity to the hospital is such that it allows rapid, either C-section or vacuum delivery, something like that, to get the baby out safely, then I think you're better off than if you're at home and you have a problem. That's just my opinion. In the U.S., there's just not good community to hospital support at this point for home births. So I think you're better off in a birthing center. But I will tell you, Sarah, I don't know, whether you think about McKay or Ogden Regional for delivery, but McKay really tries really hard to have as homey of a birthing room as they can for moms who want that experience. So it's room 2 on labor and delivery, 4502. And they have a big tub, which I made a video about that too, water immersion. It's called water birth during pregnancy or something is the YouTube name of that video. But really you're talking about water immersion, so getting in the tub during the first part of labor has been shown to cut the risk of needing the epidural dramatically. So, I think McKay does a really good job of that. It's a nice, homey looking room. It doesn't even look like a hospital room. And they have this nice big tub. So I think if those are kind of your thoughts, then, you might consider McKay. They do a good job of trying to make it as homey as they can. So there's that. Okay, so Joey, hey Joey, let's see, what age should I want to be checked out? It's not a period yet. So it's a good question. You know, there's a difference between no period at all and irregular periods. So for the first several years, for some young women, their periods may be erratic. They may be every 3 months. They may be every 6 months. They may only be a couple a year. But that's different than 0 periods whatsoever. And the other thing to look at is, has other development occurred? So it's telarchy, which is development of breast tissue, adrenarchy, which is like underarm hair, pubic hair, stuff like that. And then it's the gonads, so that's when you start to see periods and all that. And menarche finally when you have regular periods. So, you know, if there's been no development at all, then, you know, probably by, 13 or 14, that'd be unusual. Now, I'm not a pediatrician. I don't take care of kids that young. And you don't see this delayed puberty very often, so I won't claim to be an expert on that. But, you know, somewhere in that early teens, if there's none of that development's happening, it's worth getting them checked out. I think if anything, the trend is towards earlier development, and you're all women, so you know better than me what was your age when you started having that. Oh, Katie just commented, thanks about the YouTube feedback there. So you guys know better than me, but I think, 12, 13, you're seeing some development, and if you're seeing nothing in your 13, 14, 15, that's unusual and probably worth getting something checked out there. Okay, so Cheyenne said whether the symptoms are going to be pregnant with IUD. So breast tenderness, so other symptoms besides like no period, if you had an IUD, so breast tenderness, moodiness, maybe some bloating, you might have some cramping or spotting. I just say, hey, if you have a question, just check a pregnancy test and you'll know, and that'll answer it for you. Naomi asks, is it possible to have a VBAC after 2 C-sections? Yeah, it is possible, and I had a patient who recently wanted to try, and she got to like a week and a half past her due date, and we finally just gave up waiting on labor to start. But it can be done. The risk may be a little higher. About 1% is what we quote for 1 prior C-section. It may be double that if you've had 2 C-sections. But our college, the American College of OB, says we should not discourage you from trying after 2. I don't think anybody's going to try after more than 2. So, if you want to try to VBAC, now's the time not to wait for that next C-section. You really need to do it in a hospital where immediate intervention. So McKay and Ogden Regional are good places for doing that. I think everybody in our practice would be supportive. I know I am. I just kind of explain to people and say, hey, you may have a little higher risk. And also, Naomi, I don't know if you heard me say this before, but I made a YouTube video about this on my YouTube channel, which is West D Ski. Someone wrote it in the comments up above. You can scroll and find it. So you can check out that video. It talks to you about the chances for success. Delayed cord clamping. It's good. I made a YouTube video about it. I'm starting to get repetitive. The benefits are clear. Less risk of fetal anemia, slight risk of jaundice, but that's slight. So if you have a baby who's had jaundice in the past, you might not want to do it, but otherwise I think it's great, and there's plenty of evidence of benefit. And there's a whole video about that on my YouTube channel, so check it out. Okay, McKenna says, can you have VBAC after 3? The 3 C-section, I don't think you're going to find anybody that wants to do a VBAC after 3, only because we just have no idea what the risk is, like what the actual number is. Is it a 20% risk? Is it a 50% risk? And when I say risk, I mean of uterine rupture. If your uterus ruptures in labor, it is potentially life-threatening for mom or baby. In those situations, sorry, I'm getting a text from the hospital. In those situations, I just personally wouldn't think it was worth the risk, but it's hard to know what your chances really are. It's going to be hard to find somebody to do it after 3. Maybe, I doubt they even will at the University of Utah, but that's a tough one. After 2, I think you're still good, but after 3, I'd be really, really nervous. All right, so Jayden asked, what insurance does Circle Life? I think the easier answer is to say, what insurance do we not accept? And I'm pretty sure there's none of them. But you can call the billing office, or call the main office number. It's on the Facebook page at the top of this whole thing, 337-5800. They can tell you. The office is closed today, but they'll be there tomorrow. But pretty much every insurance there is, pretty sure we take it. Hey, Jess. Oh, thanks. You live in Florida now. Had your third baby last week. Congratulations, and Merry Christmas to you guys too. Hey, post a picture on the Facebook page or a little blurb on YouTube so we can see your new kiddo. All right, Jerome asks, do you support family-centered cesarean for women who need to have C-section, like being able to hold the baby on the operating table? Delayed cord clamping for sure. If the baby's vigorous, if the mom is not bleeding too bad, because the uterus is open and sometimes there's not much bleeding at all. In which case, I think it's totally cool to do the delayed cord clamping. If you're having a lot of bleeding, I worry that we're exposing the mom to risk of excessive blood loss, even waiting around for a minute. So, but if it's not too much bleeding, then for sure, delayed cord clamping is fine. Holding the baby is fine. It's just a little awkward, because you get the operating drape there. And I mean, if you've had a C-section before, you know what I'm talking about. There's this big drape up in front of your face. But we can get the baby around that, and you can definitely work with that. And for sure, McKay is very supportive of doing that, and Ogden Regional will do it. So I think in either place that I work, it's not a problem, and it's all doable. So yeah, I'd say that's a yes to your question. Naomi, 10 pounders, yeah, there you go. Okay, so Jaden, can you get flu-like symptoms in early pregnancy? Yeah, I mean, you can, and it could be the flu, or it could just be pregnancy. Probably the one that's obviously the most clearly going to be the flu is a fever. I mean, you don't get a fever from being pregnant. So if you have body aches and feel like crap and you also have a fever, then that's more likely to be the flu. And if you don't, then it's probably not. So there you go. Let's see. So just reading through Sarah's comment here, birth center birth, recommendation from the birth center, level of anxiety, C-section waiting to happen. It kind of cuts off. Sorry, I can't read the rest of it. But congrats. I'm glad you had your baby, and I hope everything went well. Are there theories? Sarah asked, are there theories behind causes of strep B? No, it's a great question. It's one of those chicken and egg type questions. So we developed, with bacteria. So when you're born, you get bacteria from your mom, and they get into your gut, and they're a part of us, and we're, and so essentially we're a part of them. So it's a real chicken and egg kind of deal. Why are some bacteria bad for us and cause problems, but then the vast majority of bacteria are actually good for you and do good things? So the short answer is we don't know. It's a good question. Sarah, at what point do you need to see a fertility specialist? So I think that basically if you've seen one of us and we've done the initial evaluation and we've done some initial treatments, then I think, it's maybe time to move on. Not to sound like a broken record, Sarah, but you probably know what I'm about to say. I made a video about this. It's called Evaluation of Infertility. It's on my YouTube channel. It's, again, Wes D Ski, all one word. And you can see what evaluation of infertility looks like. And if you basically think, yep, did all that already, then, maybe it's time. But happy to, see and talk more about that in the office. Let's see. Megan, do you guys guarantee ablations? No, darn. Sorry to hear that, Megan. Like I said before, 80-85% of folks, and that's 5-year data. So unfortunately, if your period's already back, then you didn't even get the 5 years. So sorry about that. Sometimes you can do repeat ablations. It sort of depends on the type of ablation that you had done. But for some people, if it's not working out, then that's not an uncommon reason to consider hysterectomy if the period's bad enough. So sorry about that. Let's see. Any says remember natural childbirth. Can't find much Lamaze information. I think hypnobirth is a good one. There are hypnobirth people affiliated with McKay. Sorry if I keep saying McKay a lot. We're an independent group. I just happen to do a lot of stuff at McKay. I'm actually the chief of OB over there some of their times, and I know a lot about the resources. So they have a great hypnobirthing instructor. So you might check that out. I know that there's hypnobirthing YouTube videos, so you might check that out as well. So good luck on that. And if you haven't seen it, Lexi, check out the video on my YouTube channel about, it's called water birth, but really it's water immersion during the first phase of labor. Okay, Sarah. Hey, Sarah. Are there any tips to having smooth birth before 1 week? Not really. I mean, basically, we just have to be patient and recognize that it was, we're forcing this to happen artificially. It's not going to go fast, probably. So probably the big word that I'd have for being induced at 41 weeks is just patience. It'll happen. Courtney said, had my tubes taken out and I have terrible periods, PMS. So it's not related to your tubes being removed, Courtney. But for a lot of people, it's something has changed beyond that. So let's say, for sake of argument, hey Desiree, how's it going? So stopping birth control pills because you had your tubes tied, maybe that has changed things a bit. That could be the issue, is that there was something that you were doing before for birth control that you then stopped, and now moods are different. So it's worth coming in and talking about if it's still bugging you down the road. All right, let's see. Desiree said, how late in pregnancy is too late to travel internationally? Are you trying to tell me something here, Des? Prior to 20 weeks, for sure, no problem. I kind of think of it like pre-viable versus viable. So around 23 weeks, then, you've got a viable baby. So then it's like, well, where are you going? Well, come see me. And even prior to, say, 28 weeks, if you don't have any history of preterm birth or anything, then it's probably fine. Okay, let's see. So I'm just reading through Jerome's comment here. It cuts off after a certain number of lines, but it sounds like Housel was supportive, so I'm glad they did it. Okay, Sarah said, what do you suggest for postpartum depression? All the same medications that we would use for just standard depression still apply. So that's the whole list. Paxil, Prozac, Zoloft, Celexa, Lexapro, Wellbutrin. The list is like that long. So any of the standard meds, if your depression is severe enough to warrant medication, are all fine in nursing. So any of them are fine. I just suggest, make an appointment, be seen, get checked out. Let's see what else we got here. Stacy, is there anything I could do after having 2 early miscarriages to help not have another? Broken record. I have a YouTube video called Evaluation of Recurrent Miscarriage. So check it out, because there are some things that you need to get checked. And if you haven't had them checked, then those are the things that I would do. So it's a long list. I don't want to go through them all here. But go to my YouTube channel, West D Ski, and it's probably 2/3 of the way down through the videos. There's one that's called Evaluation of Recurrent Miscarriage. So when you say, is there anything you can do all that stuff. And then secondly, taking a low dose of aspirin might reduce the risk. But if your evaluation is otherwise negative, from the list of stuff I mentioned in the video, you might consider chromosome testing on you and the dad, if you haven't had live-born kids, especially. So check out the video, and if you have other questions, make an appointment, come see us. We're happy to get things going. Okay, guys. Well, we've made it almost an hour. This is pretty amazing. This has gone way better than I would have thought, and I want to thank everybody for jumping on here and asking questions. We're going to go about 5 more minutes. We're going to call it a day. So let's see if any other questions roll in. Kylie just put one up. Can I take anything else but Tylenol? I had a headache for 4 days. Yeah, the headache thing in pregnancy is so common. Tylenol is the safest medication. Of course, you don't recommend, narcotics and stuff like that. Excuse me. If you have a history of if you have a history of migraines and you're not in the first trimester and you think it's a migraine, it's not wrong to think about like Imitrex and stuff like that. There does not appear to be any concerns about safety with regard to Imitrex. So if someone has a history of migraines, has taken Imitrex in the past, and they're not in the first trimester, I don't think it's a real big problem to take that. But if you don't have that history, maybe it doesn't apply. The other things I tell people are make sure you're well fed, hydrated, and rested, and maybe a little bit of caffeine. And for a lot of people, some combination of those will do the deal. Okay, Amy says, is feeling some rectal pressure. I'm 37 weeks. Pretty much what you do to relieve that is to have a baby. That's just the baby dropping into the pelvis, and it hurts. There's no question. I tell everybody you should put underneath the word pregnancy, just put it hurts everywhere. But that sounds like normal stuff. Close praying, you don't too much. Kind of, Aaron, same thing I was saying before. If you're not nursing, it's probably not that big of a deal. If you're nursing, it could affect breast milk supply. So, but aside from that, fine, go for it. Have a baby. We're all for it. Okay, so let's just see if any other questions pop up for the last little bit here. Guys, thank you so much to everybody who asked all the questions. I really appreciate you jumping on here and spending your time with me. Do I deliver Ogden Regional? Yes. Yes, I do. I just delivered there this morning. But thanks to everybody who jumped on. Really appreciate it. If you like it, put some likes or comments or whatever in the Facebook thing. Check out the YouTube channel, Wes D Ski on YouTube. A lot of the things we talked about today, there's a lot more information on there. Put questions in the YouTube videos for sure. I check it like 5 times a day. Thanks for all the thumbs up, everybody. I really appreciate that. Let's do this again. So Tuesdays are a good day. I don't know what everybody else likes, but as it so happens today, the office is closed, so it was great. But Tuesdays are a surgery day for me, so some afternoons on Tuesdays I have time that I usually make YouTube videos. But I'm happy to do these Facebook Lives, so if you guys like them, let me know. How many deliveries do you do a week? Totally varies, but probably good average number is about 10, 12. It just kind of varies on the month, how busy it is. So it's like 1 or 2 a day, somewhere in that neighborhood. Today I'm going to have 3 that I know of. We'll see what happens. I've already done 2. So thanks again, everybody. Really appreciate you spending your time. Put the questions in the bottom of this thing or on the YouTube channel. Happy to answer them. Thanks for watching. We'll do this again, and maybe next Tuesday. We'll see how busy it is. And thanks for all the thumbs up. Merry Christmas to everybody. Have a great day. Thanks for watching. See you later.